So thank you all for joining. I will now introduce today's presenter. Dr. Jeanette Waxmonsky's research focuses on the tailoring and implementation of evidence-based interventions in healthcare settings to enhance accessibility, uptake, and effectiveness. She has extensive experience in real-world research focused on actively involving providers and patients in multi-site research studies. Dr. Waxmonsky has held industry executive and senior management roles in health plan clinical operations, telehealth, and health technology. And in her current role, Dr. Waxmonsky helps lead strategic initiatives to promote, support, and disseminate cancer research, as well as facilitate partnerships with a variety of Colorado catchment area organizations, local communities, healthcare systems, and government agencies. Dr. Waxmonsky is a faculty member in the Colorado School of Public Health with a secondary appointment in the CU School of Medicine's Department of Family Medicine and is a licensed psychologist. Thank you, Dr. Waxmonsky, for being here with us this afternoon. I will now stop sharing my screen and turn it over to you.
Okay, let me see if I can get it going. All right, can you see my screen, the presentation mode? Great.
Yes, it's good.
Okay, wonderful. Well, thank you all for joining me over your lunch hour today. And today I'm just going to go through some sort of a primer of what community engaged research is, some of the methods that you can engage in to enhance your research and get that kind of community input that may be very helpful for your research question design all the way through your dissemination of your project. And share some examples from the Cancer Center and some personal examples from other research I've done in different areas. So again, thank you for being here at noon. Let me see. So that those were my objectives. So basically today I'm describing what community engaged research is, how to identify specific methods and resources that you can use for your research, especially the resources we have at the Cancer Center through the Office of Community Outreach and Engagement, and then discuss some of the outcomes from community engagement. So what is community engaged research? You can describe it in several different ways. First of all, it's a set of practices, values, and objectives that define a respectful, responsible, and reciprocal research relationship. It is a relationship with community. And it is a process that you work through with community through the life cycle of your research project. So you're collaborating with communities, not on communities, but with them and through their community members. So you need to spend a lot of time working with the community to identify and address issues affecting their well-being in their particular community. And then this is a research that ultimately aims to impact quality and the improvement of individual and community health, and also to build capacity for the uptake and sustainability of evidence-based practices. When I mention community engaged research, it means a lot of different things, but I would like to just start by identifying what separates it from traditional research. Basically, the research question in traditional research is defined by the researcher, but in community-engaged research, it's often co-created with the community. So it may be a question about breast cancer screening. Is that something that's important to the community? What does the community want to know about breast cancer screening? What education, what methods of dissemination of that education might be important to the community? And that can help define your question up front. The methods are a little bit different. The researcher doesn't decide these solely on their own. Basically, you talk to your community about, who needs to be a participant in the study? What kinds of methods are you going to use? What kind of outcomes are important to the community? And a lot of times, the methodology for these studies is a mixed method. So you're using qualitative data in the form of uh, key informant interviews or focus groups, as well as collecting quantitative data such as health outcomes. Also, what's a little different too is there's shared responsibility for data collection and interpretation. Usually you pay someone in the community to help with data collection if possible. Um, and then also have the community interpret the data too. So share back the data to your community members. And when I say community, I mean, provider groups, it could be policymakers, it can be health plans, it could be patients and caregivers, community members, people who live in a certain regional area. Um, Community means a lot of different things. One thing I have found really helpful in community engaged research is making sure that you share that data collection or the results of your data back with the community and ask for their feedback. A lot of times researchers will come into a community or have participants in their study, and participants don't know what happened at the end of a research study. And when they get a chance to find out the results of the study they participated in, it's really meaningful for them because they don't know what happens. They don't tend to read peer-reviewed journal articles. And so another part of that separates traditional research and community engaged research is dissemination. Typically, academics, have their publications and their conference presentations, whereas community and members may use social media or different kinds of channels. Also, there's a policy piece that's very important for community members. And how do you engage with your legislature or decision makers in your community? And then outcomes. Obviously, traditional research advances the science, but beyond advancing the science and community engaged research, there's a mutual benefit and bidirectional learning. So what you want to have ideally happen is the researchers learning about the community, some of the nuances of their research, some questions that they didn't think of, or learnings that they wouldn't have gathered from the research if they didn't involve community. And the community is learning about research and how to actively be involved in the research enterprise. Research, our community engaged research is on a continuum. So you can have on one end of the continuum some basic collaboration all the way to sort of empowerment and bidirectional communication. So sometimes researchers share information with the community about a study, or they receive feedback upfront on the feasibility or the aims or procedures in a study. So they consult community advisors. As you progress along this continuum, you'll see participation. So you engage the community in key pieces of the research, recruitment, data collection, and then as you move towards the right end of this diagram here, you'll see that the community begins to bring problems to the researchers that they can address together, and the community leads the decision making for the research. So this is where you really build a nice partnership with your community, and this takes time and trust over time. So it is some work, but it definitely is the ideal situation for community engagement. It's nice to have, but not always necessary for the type of research that's being done at the Cancer Center. So I wanted to give you some examples up front of what I'm talking about with community engagement. This is a study that Evelyn Barrio did on head and neck, lung, head and neck cancer patients who are underserved and their caregivers. I was a co-PI on this project as well. And prior to the study proposal being submitted, there were several studies, pilot studies, where qualitative data was collected from clinicians, patients, and caregivers. And some of the things that came out of that discussion through those pilots via key informant interviews and advisory groups was to include all low-income patients and caregivers, not just Hispanic patients and caregivers. And another key piece was caregivers should participate in the intervention because they also need mental health support, as well as the patients do. Some of the measures that came up that people wanted to look at were obviously depression, anxiety, lack of coping skills, because these are mental health concerns for people who have lung cancer and head and neck cancer. That there's a lot of emotional distress associated with these types of cancers. Also, the stakeholder group provided modification of the intervention. Basically, they said, yes, it should be delivered in a step care format because patients' and caregivers' mental health needs progressively increase over time as the cancer treatment progresses. So this is something that they did to help modify the intervention, and they also helped with the development and implementation of the study protocol. These were the aims of the study, and as you can see, it was to work collaboratively with the community here to develop the protocol, to adapt the intervention and enhanced usual care, because this was a comparative effectiveness study, and that was the other arm of the study. But to adapt it to make sure it was sensitive to the participants' characteristics and properly applied, monitored, and integrated with the clinical care being delivered at the 3 different hospital sites that participated in the study, and basically to conduct the study. And what we did see, and I'm just going to quickly go through this, is that the step care intervention had better mental health outcomes, particularly for depression, coping, self-efficacy, not for anxiety, also for emotional distress. What we didn't see was really an impact of the intervention for caregivers. And that's something that we should further study in additional studies, and something we learned through this research study. So that was that's an easy way to not easy way, but that's sort of the typical way we engage patients in studies, more what you would see in the cancer center and the cancer prevention and control group. However, basic science can also engage community. And Dr. Tintin Su has done some really nice work in Pueblo, looking at how Pueblo has a significant history of steel mills, smelter operations, and coal mining or coal processing, all of which have led to environmental toxins, a lot of heavy metals in that area. And she was in a listening tour. She participated in a listening tour in Pueblo and learned from people that, and I'll just read this quote here because I think it's really important. We just wanted to listen to people. And it struck me that I kept hearing from people about environmental toxins in the area and their concern about cancer. So based on her listening tour, she does research looking at the consequences of DNA damage by X-rays, and this inspired her to add some catchment relevance to her basic research in her lab. And with her partner, they looked at some of the uh, um, kind of environmental toxins, basically lead, cadmium, and arsenic, which are carcinogenic, looking at the high levels of that in the Pueblo soil. And what they also found is that the exposure was uh, particularly in areas with a larger Hispanic population. And so Hispanic populations were being exposed at a greater rate to environmental toxins in Pueblo. So they had a pilot study that they looked at and wanted to look at the effect of toxic heavy metals on DNA, and they looked at them in combination as well. So that was more of a real world kind of look at what's happening in the soil. And then they found out that the lead and cadmium synergize to induce DNA damage in cells. So based on community input, they did this basic science research that was very powerful. All right, so I'm going to switch and talk a little bit more about community engaged research versus community-based participatory research, which some of you may have heard of. Community-based participatory research, or CBPR, is a subset of community engaged research. And it's the most community-based, and it is sort of ideally what you'd like to get to, but it doesn't have to be. Every study does not have to be CBPR. A lot of community-based research, our community engaged research, as I mentioned, involves a partnership where the community is involved in varying degrees. And community-based participatory research, there's this co-partnership from the beginning in terms of your research. Also, there's decision-making that's co-shared, and there's shared power and authority in the research design and dissemination of the research products. Where community-engaged research, there's a little bit of that. The focus also for CBPR is more on action and research for change. So really pushing forward the dissemination of research findings for policy change and improving the health of communities. And sustainability, oftentimes with community engaged research, it may just end with the project when the funding ends. But with CBPR, you're really trying to build that long-term capacity. Some of the key elements of community engagement, just in general, for people to kind of keep in mind is there are core principles. So it's this co-equality or co-creation. Oops, sorry, didn't mean to advance. Equity and financing. So making sure that if you're engaging the community, you're not just expecting community to participate in your research out of the goodness of their heart. You're wanting them to be compensated financially for their time. It's an ongoing relationship. That's really important. It's the researcher should not just helicopter into a community and helicopter back out when the study's done. One of the things that I've heard from community members is you can't just leave the community at the end of the study in a place where they're the same or worse off your study. You want to make sure that you leave the community in a better place from your research. Your research needs to be culturally responsive. It needs to be culturally centered, making sure that you think of what that community needs, how you explain things to the community, what language you use, making sure that you're using terms that they can understand, making sure that there's knowledge shared in a bidirectional way. So you're learning from the community and they're learning from you. Also, decision making around the study should be shared. You're really trying to build trust and inclusivity in your project. And you're really hoping that you can create a partnership that focuses on long-term benefits, financial and clinical sustainability. Now, granted, this is sort of the ideal, and this is what we should work towards. Because what it allows us in terms of products, I should say, are expanded knowledge, strengthened partnerships and alliance. These are all things that can be measured, improved health and outcomes, programs and policies, and thriving communities. And all these bullets under here, like, are things that can be measured. And this comes out of the National Academy of Medicine. For those looking for funding, if you decide to submit your proposal to the Patient-Centered Outcomes Research Institute, or PCORI, there is a big focus on making sure you engage the community, engage your stakeholders throughout the research cycle. And you will have to fill that into your proposal. And they have some guiding principles about what that looks like. So reciprocal relationships, transparency, honesty, trust, partnerships, co-learning. And they have their 6 pillars of foundational expectations for partnerships and research, kind of stuff I've already covered, but you want to make sure you have representative involvement, ongoing, early and ongoing engagement, dedicated funding for engagement and partner compensation. You work for around team building and you build that capacity. You include the partners in decision making, and you review and you engage. You have an ongoing review of your engagement. Community engaged research and dissemination of research findings they overlap a lot, I will say. So basically, if you have community engagement in your research study cycle or your research cycle, it's going to help translate your research into practice faster because you're going to get input from stakeholders. And again, those stakeholders can be community, they can be providers, they can be policymakers, they can be insurance carriers. But basically, you're going to be able to answer some of these questions for dissemination. Is the evidence ready for use? Does it respond to stakeholder concerns? Because you're going to ask your community about that. Who will benefit from the evidence? How can you reach the audience? How can we make the evidence available? What information will about the evidence will people need? How can we support adoption? What strategies? And how effective are our strategies? What data do we need? So this is sort of the dissemination cycle, but it fits very well with community engaged research. And hopefully, you're bridging the gap between research and real world applications sooner and better by having the stakeholders through the process. And when the community knows what you're doing in terms of research and feels included and feels they have a say, you're creating that trust. And that's extremely important. And a lot of research studies do want some kind of stakeholder engagement. All right, so why conduct community engaged research? I think I've kind of covered this already, but you're improving the relevance and quality of the research findings. You're making them more applicable for real world settings. Your research reflects community needs and priorities. You're increasing trust and understanding between researchers. You're building partnerships that hopefully will be long-term. You're understanding unique desires and needs of community and incorporating their insights into your work. And when people feel that they're valued as part of the research enterprise, that's going to help with recruiting and retention of diverse participant populations, because your community will help you engage participants in your study. And then they also can help, this kind of research can help create sustainable health interventions post-study, interventions that the community can feel that they own part of it. And hopefully we will ultimately change healthcare policy to support and sustain cancer prevention and treatment through this type of enterprise. There's a lot of community engaged methods per se. It's not like a particular method is important. It's more of how you do the method. So basically things you can do are key informant interviews, focus groups, community advisory boards, and use of participatory mapping tools with your community members. You're going partnering with local health organizations and advocacy groups is really helpful. To have them in your court and doing this work and helping them, or having them help you find community members to engage in your study. And it's an iterative feedback process during data collection and analysis. So you can use learning collaboratives where your community meets with you or your providers meet with you, and you share learnings throughout the study of implementation of whatever you're doing. And you can co-create dissemination strategies, policy papers, community forums, reports, and that are bilingual. This is an example of a breast and cervical cancer screening study that really showed community engagement throughout out their study, and it was looking at ways of tailoring breast and cervical cancer screening, particularly for a Hispanic population. And I know this diagram is probably a little hard to read, but it takes you through I should say it illustrates the community advisory board's role and the research team's role from the beginning. So looking at the research questions, objectives, getting your community advisory board together, creating the research objectives together, and study design, drafting the interview questions. There's a feedback cycle here, testing interview questions, doing interviews with the community participants, analyzing those themes using a fishbone diagram, training the community advisory board on mapping tools and how to analyze data, and then using a couple different sort of mapping techniques to come up with their final product for their study and their final intervention. So here's a fishbone diagram that was created in that study, just to give you an example. The advisory board and the researchers figured out that, part of the issue with cancer screening is both barriers and facilitators were providers, process, people, place, payment, and policy. And then they wrote specific information that they saw as in regard to barriers. Later, that information was combined, and each CAB member, so the Community Advisory Board member, had a chance to do a mind mapping exercise using a template where they showed lines and colors and lines to illustrate relationships between concepts, and looked more, in depth from their point of view as to what some of the barriers were in that to breast and cervical cancer screening. And then later on, there was an exercise with the community advisory board, just brainstorming around solutions. And the facilitator later helped group those into communication, scheduling, transportation, and providers. and the community helped design the solutions for increasing cancer screening. But I just wanted to give you some examples of how to work with community in some interactive ways in terms of mapping. There's a lot of outcome domains for community engaged research studies. Um, you don't have to worry about all these things, I would say, unless you're doing CBPR research or you want to. Really, you need to think about your research outcomes. What do you need as a researcher, whether you're a basic scientist or whether you're working with population health? What are the important research outcomes in your study that hopefully your community gave you input into? What are the patient-centered health outcomes, if applicable, that are important to your study? Reach, how many patients did you engage in your study? What were their characteristics? What was the effectiveness of your intervention if you're doing kind of an intervention study? How did you disseminate your results? What was the reach of that uh, dissemination, and did it impact policy? And were you able to sustain, say, an intervention that you developed? There's a lot of community engaged research kind of measures out there. I picked this one just to illustrate. This one's got like 10 questions, and it just shows you like how you can kind of um, quantify your relationship with the community. So it gets at domains of partnership and alliances, shared power, structural supports, and community alliance solutions. So just want to again give you another example of how you could measure what you're doing in terms of community engagement. As you probably can guess, there's a lot of challenges in doing community engaged research. There's a lot of logistics. Trying to integrate community members into research settings can be difficult. Excuse me, explaining complex scientific concepts in lay terms takes time. Making sure that your materials and processes really in um, take into the concern of the community about like what's going on in terms of language, making sure that people can understand what you're saying, and understand those scientific concepts in a way that makes sense to them and doesn't feel like you're um, talking down to the particular community. Institutions and IRBs can get in the way too. You may have to make the case for explaining why you're engaging the community in the research process. And there's differing priorities between community and researchers. So that's something you'll have to kind of come up with a process for how you manage disagreement between the community and yourself, and come to some kind of conclusion that you're able to work with together, some compromise. So as I mentioned, there's a power dynamic. You've got the researcher with the resources and the education, and how do you empower the community to feel like an equal partner? Both researchers and community members need training to do this kind of work, and that takes time and resources. And then time is something that really comes up in community engaged research, especially community-based participatory research. I put windshield time here because this comes from one of my colleagues in family medicine who describe windshield time as the time you spend in the car driving around the state of Colorado to meet with different communities. This type of work really does require going out and meeting the community where they are. And then you have to think about funding and compensation and resources, and then have a process for communication. So these are all the challenges involved with doing this kind of work. All right. So the good news is you don't have to do all that work on your own if you're a researcher. I'm part of the Office of Community Outreach and Engagement, and our job is to serve as the bridge for researchers and the community. And we offer a lot of resources. After this presentation, if you have any questions about the resources I'm about to go through, please feel free to outreach me, and I'm glad to explain more or help you in any way I can with engaging the community in your research. So we're on a mission at COE, Office of Community Outreach and Engagement, to really help engage communities in research to help them understand their unique cancer-related needs and challenges, foster partnerships across organizations and health, both academic, with healthcare providers, community organizations. We provide educational outreach and awareness campaigns, and we monitor social economic challenges and advocate for policy changes that support cancer prevention and access to care and equity in treatment. And we continuously monitor and evaluate our initiatives. Some of the services we do provide is we do Spanish translation for investigator initiated trials. We have community outreach and education at health fairs all around the state. We have the Exploring Cancer in Colorado tool that I'll show you a slide in a second. We have a community needs assessment. We have some groups here that I'll talk a little bit about too, which is Community Advisors for Research and Equity in Science, research roadshows, and a new forum for researchers to share their studies and their research with community. So we offer free cancer screenings and education at health fairs. We establish partnerships with community organizations. So we're connecting to community, and if you contact us, we can potentially help you as a researcher find partners in the community to support your research. We've completed a community needs assessment that looks at sort of a cancer snapshot by county and disparities across the state for some of our priority cancers within Colorado, and this is available online. There's a link to it there. The Exploring Data in Colorado, this tool is an interactive data source. It's online. You can look at cancer burden, risk factors, cancer disparities and demographics. And it's a very nice tool to summarize kind of the disparities across the state. Here's an example of looking at the map, the heat map for, say, looking at all cancer sites within the state, and you can see where there's significantly more cancer prevalence or incidence. And you can look at things like screening rates for, say, breast cancer around the state and where those cancer screening sites are. I co-lead the Community Advisors for Research, Equity, and Science, our COE CARES, and this is a forum where investigators can come present their research ideas, their proposals, their ideas for dissemination of their research to cancer patient survivors, caregivers, family members who have some training in cancer research methodology. And they serve as advisors for proposals sometimes. They do review study materials, they review retention, recruitment strategies, and they sometimes serve as grant reviewers. They're willing to help out as any way they can to support research. And we've had over 12 researchers who presented at CARES in the past year or so. And it's been a positive experience overall. Here's some quotes from a researcher receiving feedback, learn more effective ways to present their research to community. So this is an opportunity available for Cancer Center members to present their research. We also have research roadshows now, which is really new and exciting. We've partnered with the Multidisciplinary Center on Aging, and we're going out to the community and we're bringing our researchers along to present to community. We have 4 roadshows planned. We've had one in Pueblo, we had one in Greeley last week, and we had 115 participants, which was great. And these are folks who want to know what the Cancer Center is doing. They want to know about research. This is a great benefit to you all if you're a researcher, to get out and talk to community, to expand your reach and your recruitment. You can recruit people and consent them at these roadshows. So it's a way for the community to feel connected and supported also by the Cancer Center. And so it does make the research more accessible and more personally meaningful, and having that conversation, that bidirectional communication, is really helpful for people to understand what we're doing and also to give input into research studies. And there's a lot of things you can do as a researcher at these studies. You can screen for eligibility, collect feedback on aspects of your research project. As I said before, enroll participants and provide education both ways, bidirectionally, both on the community educates the researcher on the community, and researcher educates the community on research. So it's a great experience. I'm starting a series now where we're going to have investigators meet at the Aurora Library to present their science in an interactive format, so they can garner feedback from community members on the research studies, and hopefully find this experience meaningful. So stay tuned. This is just starting and it will go for 6 months. And if it's successful, we'll continue to do it monthly. Another thing I wanted to show is that COE has helped with Meredith Tennis's help from MCO, is create these infographics for community members about what the programs do. And try and explain science in more layman's terms. So there's a series of these for each of the programs. Other resources besides COE on campus are the CCTSI, the Colorado Clinical Science and Colorado Clinical and Translational Science Institute. And they offer consults, they have community engagement forums, they have an immersion training where you go work with a community around the state of Colorado. So there's a lot they offer as well. And in the interest of time, I'm just going to give you some takeaways about community engagement. I went through this rather fast, but just to give you an overview. But what taking a step back, if you are going to do any kind of community engaged research, really ask the community first. Is this of interest to you? Have a dialogue about that. Like, what kind of research questions is the community interested in knowing about cancer? Know that it takes time and commitment to build trusting relationships within the community. And if one investigator destroys that trust by their actions, it makes it harder for everyone else to regain the trust of the community, everyone else meaning other researchers. We know that this yields more lasting results, this approach. Having the community engaged in the research process makes the the results more meaningful, more impactful. You do have resources to help you. You don't have to figure this out as an investigator. Please contact me. I also know folks at CCTSI who can also be helpful, but we're here to help you in your research. And your research partnership should leave the community in a better place than when you met the community. If you could kind of keep that in your mind, that I think that's the most important point that I can share today. And with that, I will answer any questions.
Great. Thank you, Dr. Waxmonsky, for a really great presentation. I received a couple of questions through the chat, and then other folks on the call today, please feel free to put any other questions you have in the chat. So you talked about this a little bit towards the end, I think, but we have a lot of really wonderful staff on the call with us today, who are clinical research coordinators, trial startup specialists. So do you have any other thoughts on practical steps that like clinical research staff can take in their day-to-day to enhance the work that's being done with community engaged research trials?
Yeah, that can take a lot of different kinds of paths, I guess, but you could do simple things by you know, like understanding the types of patients you're trying to get involved in a protocol, like when you're recruiting patients or when you're trying to retain them, understanding how kind of what the barriers are to treatment, what things they're coming up against in terms of participating, say, in a clinical trial. And that's also another area where COE or the Office of Community Outreach and Engagement can be helpful, because some patients may have difficulties with language in terms of understanding some of the nuances of getting into a clinical trial. We provide patient education around what a clinical trial is. There's a lot of myths out there in the community about cancer clinical trials, like that's sort of the last ditch effort for any kind of treatment, which is not true of cancer trials. So we can provide that kind of education for your patients. We could also help you kind of overcome some of the cultural barriers in working with a particular population, and providing you with language or ideas on how to engage a particular patient population.
It's great. Great. Thank you. And so towards the beginning of your presentation, you showed this great kind of like spectrum where you're moving towards either community-driven or community-led research. So in your experience, are there any like markers or benchmarks to indicate that a community might be ready to be kind of further along that spectrum, or even thinking about like CBPR research? Are there any indicators that a community might be ready to be further along that spectrum?
That's a good question. I think part of it is going to be, kind of what's the engagement you're getting with the community. So are you able to talk to community leaders? Are you getting people at the table? If you have some kind of forum where you have community meet with you, are people interested and engaged and willing to work with you on the proposal? And if you have kind of expectations ahead of time, like, hey, this is what I want the community to do. Like, I want your input on X, Y, and Z. This is how much I can pay you for that. Here's how I'd like to kind of communicate with you about the process, like as much transparency about the process up front and what you can do and can't do can help with that. And if the community is receptive to that, then I think that's a good start for getting them more engaged.
Great. Thank you. Okay, so one other question. Is COE or CARES promoting and engaging the community on specific trials or able to present certain trials in the future? And this would include sponsor or industry funded trials.
So the way COE Cares works is that an investigator comes and presents their research, and it could be any type of cancer center trial. You just have to be a cancer member or affiliate member of the cancer center as an investigator to present. So we take all comers.